Suffering patients, suffering doctors. How can good prevail? In the history of our planet, no man has suffered more publicly than St. John Paul II. And not only did he teach us about suffering by his witness, but also by his words. In Salve Fici Dolores, he says that suffering is man's experience of any kind of evil. And what is evil? In one sense, it is nothing. It's a parasite. It's a certain lack, limitation, or distortion of something that is already good. Man particularly suffers when he ought to share in something but does not have it. And the thesis of my talk is that there are two such lacks or limitations, two such evils afflicting physicians, and until they are addressed or ameliorated, they will not be able to reduce patient suffering. And that one way, among many, that these evils can be ameliorated is through the Catholic Medical Association. So let's move on to these two evils and possible ways of overcoming them. The first evil is alluded to in a famous talk given in 1927 by Dr. Francis Peabody to students at Harvard Medical School. In this famous address, Dr. Peabody says that young medical students are too scientific and they don't know how to take care of patients. That same thing could be said today. He says that the secret to the care of the patient is to care for the patient. And in caring for patients, they expect that their physicians will be experts in the field of suffering, particularly their own suffering. But if we look for guidance to the category medical training on the game show Jeopardy, we'll find this clue and its response. The number of hours medical students study suffering in medical school. And Alex, the correct answer is, what is 0? We don't learn about it, but our patients expect us to be experts. And unless we know how to handle our suffering and then address their suffering, we will not successfully reduce their experience of suffering. So the first evil is ignorance. Ignorance of what suffering is, its purposes, its meanings, and how to address it. But there's a problem. Doctors are also suffering and they're not going to care about overcoming their ignorance until a certain second evil is overcome. And to explain that evil, let's look at how insurance companies and the government uses incentives and metrics to measure how well and how much we work. According to those, the key to practicing medicine in the year 2017 can be summed up in a few words that a medical student might say when asked the question, why do you want to be a doctor? He or she could say, I want to be a doctor so that I can see more patients per hour with higher patient satisfaction scores than any of my peers. But this going faster and being nicer is just not sustainable. One reason it's not sustainable is the electronic health record. For example, in one study of 31 million EHR transactions in California, it was discovered that only 2.8 million patient visits were accounted for. And I say only because that means the computer had to be accessed 11 times by the physician per visit. That's not very efficient or effective or patient-oriented. And furthermore, that physicians, for every minute they spend face-to-face with a patient, are spending 2 to 3 minutes on the computer or in other bureaucratic tasks. And the adoption of electronic health records has been steadily increasing since the turn of the century and took off after the passage of the HITECH Act, which allocated $30 billion over a 5-year period for physicians to start using electronic health records. What are the results of this increased adoption of electronic records? Physicians are more tired than ever because they're spending more hours than ever at work. The quality of care that they're providing patients is decreasing, and the notes they are generating are longer than ever and less helpful than ever because it takes so long to comb through them for the 1 or 2 bits of information that another physician really needs to find. But if we use these records, the government promises that our compliance will be rewarded. But how is it being rewarded? By paying us just as much money as we used to get when we didn't have to use the electronic records the way they told us to. And if we don't, we'll be paid less. And this extrinsic demotivation really reduces our job satisfaction as physicians and sucks the life out of us and leads to something known as burnout. Burnout is the second of the two evils afflicting physicians. And burnout can be described as the presence of at least one of three factors. The first of these factors is exhaustion, emotional or physical exhaustion, being overextended and depleted of emotional and or physical resources. After exhaustion is cynicism or depersonalization, objectifying patients, the heart attack in room 3, the gallbladder in room 5. And cynicism leads to withdrawal from relationships and formation of a negative attitude. And finally, what we all love in our professions is a sense of accomplishment. This sense of accomplishment is no longer happening when one is burnt out. The rate of burnout has been increasing, and for physicians is higher than any other profession, and in multiple studies is over 50%. So there's an epidemic of burnout that's devouring the soul of medicine. And as we have sowed electronic medical records and other bureaucratic requirements, we are reaping a reduced level of empathy for our patients, poor health outcomes, increased medical errors, or at least we're finding them more, increased healthcare costs, and patients who are far less satisfied with their physicians than ever, particularly because we're often on a computer instead of looking at them. And physicians who are not getting that sense of accomplishment in their jobs are trying to find it in places where they shouldn't be. And many more physicians than ever are thinking about quitting medicine, and if they're not quitting, they're at least cutting back their time. And this is not only affecting physician work, it's affecting their employees, because work is tough in a cynical, sarcastic environment. In 2012, the Institute for Health Improvement promulgated the triple aim to improve healthcare in the United States. They said they would, number one, improve population health, while number two, improving each individual experience of care between physician and patient, while at the same time, number three, reducing per capita cost. But this turned out to have unintended consequences as it was adopted by various physicians and healthcare entities. It was a bigger burden on physicians who complained that even though they tried to adopt the triple aim, it became more stressful not only for them but for those with whom they worked. And only 2 years later, in 2014, family physicians in one of their journals said that the triple aim would only succeed if it became a quadruple aim, with the fourth aim being improved physician experience. So we need this experience improved, because if we don't, we have this feedback loop between suffering doctors and suffering patients contributing to each other. How can we fight this? Well, first, against burnout, theologian from Duke University, Stanley Hauerwas, has said something I find profound. He wrote that if medicine does not have the church or a community similar to one, that physicians will not be able to endure being even present to the suffering of their patients. Not that they won't be able to ameliorate the suffering, but they won't even be able to be present to it. That's profound. And the Catholic Medical Association is such a community, and actually is such a community firmly within the church. And this organization is present to inform, organize, and inspire its members to uphold the principles of Catholic faith in the science and practice of medicine. And our motto, our vision, is inspiring physicians to imitate Jesus Christ. And I believe the most profound way we accomplish this to help us not to be burned out, but to be full of life, is through the relationships that we develop. There are other ways, but relationships are the most important. Peer support is critical. It provides people, either locally or even nationally, with whom we can share ideas, celebrate achievements, and support each other in challenging times. My inspiration to become involved at a national level in the CMA happened in 2013 when I met the members of the national board. These were energetic, inspired, and inspiring individuals fully committed to the renewal of medicine in our country, to the promotion of a culture of life. And I said, if this is the face of the new evangelization in medicine in the United States, please sign me up. And so many others have been signing up. As the last few years, we've been growing more than 20%. To now we have over 2,200 members. We have now, as the backbone of the CMA, 102 guilds locally and growing. And the purpose of each guild is to be a place where each of us can nurture and be nurtured in the practical wisdom of what it means to be a physician. It's a place where we receive and give mutual support to become a certain kind of person. That's what it's all about. And we become people like the people we hang out with, instead of becoming isolated, which is so common. Ways that the CMA does this is through our annual education conference. We've been doing that for 85 years. We have plenary sessions, we have breakout sessions, over 50 at each conference, to choose from just what will help inspire us and practically help us in our practices. We have exhibitors that cover the realm of medicine. We have perpetual adoration during the meetings, and each year we consecrate ourselves and our families to the Sacred Heart of Jesus through the Immaculate Heart of Mary. We celebrate daily liturgies, including a National White Mass, here seen in Denver in September 2017. We now have mid-year leadership training meetings at Mundelein, Illinois, at the University of St. Mary of the Lake. In this beautiful setting, people come from all over the country to be inspired, to get practical tips, to go through interactive training sessions, and to develop relationships. Because when you are having fun together, we are releasing all those good hormones and neurotransmitters that help to develop relationships. And when we develop relationships, we can work together throughout the year, even if it's on faceless phone calls, because we know each other. In 2018, the mid-year leadership training meeting is going to discover each individual's particular role in renewing medicine, their personal role that would best fit them through a better understanding of their spiritual gifts, through a better understanding of the gift of their particular temperament, so that they can learn to focus, what is the one area, if I can give my time outside of my practice and my family, that I can best renew medicine and be fulfilled in doing it. And for the first time, we're going to be overlapping with the medical students who will be having their boot camp at the same place. And boy, the seeing young medical students inspired to be authentically Catholic also inspire and fulfill physicians. At guild levels, every guild holds a white mass with its bishop, usually followed by a banquet with dinner and a speaker. Each guild tries to hold a Lenten retreat, even if it's just for a day. And some guilds even hold regional medical conferences. Something we're doing at my local guild is we're meeting at a brew house to discuss monthly over dinner a book. In this case, The Finest Traditions of My Calling, written by a Catholic inpatient psychiatrist, which looks at medicine with fresh eyes to evaluate so many things we take for granted that might be really reducing physician and patient satisfaction. And through activities like this and others, physicians become satisfied, become fulfilled, and then they want to act against their ignorance regarding suffering. And one such way is a course that's been used by many guilds throughout the country on suffering. It's based on St. John Paul's document Salvifici Doloris on the Christian meaning of human suffering. And the course, in a discussion-based fashion, which requires no preparation time and just 60 to 75 minutes a month to go through, discusses what suffering is, through unraveling the mystery that St. Paul lays out in Colossians 1:24, where he says that, "Now I rejoice in my sufferings for your sake." Well, if St. Paul has figured that out, he has taken the worst thing in human existence, suffering, and figured out a way to turn it into the greatest thing in human existence, joy and happiness. He has this magical black box that can turn suffering into joy, and the Course discusses what that something is. The Course discusses 7 purposes of suffering. There may be more, but at least 7 are discussed to answer the question, why? Why is there suffering? And furthermore, why do I suffer? Even atheists such as H.G. Wells have said there's nothing wrong in suffering if you suffer for a purpose. For example, in the Course, one of those purposes has to do with love. And this is something that even Sigmund Freud got right when he said that we are never so defenseless against suffering as when we love. And it's something that Buddhism recognizes when they say that the fundamental cause of all suffering is desire. But is not love the desire to be united with the beloved? So Buddhists recognize if there's no love, then there might not be suffering. No love, no suffering. But Christians realize that the greatest love required the greatest suffering. And we know that if one knows love, one will also know suffering. And that profoundly, the price of love is suffering. They are inextricably linked. And with this realization, St. John Paul says in his document that one of the purposes of suffering is to unleash love from those who witness it. So as physicians and as nurses, we are called to respond with love to suffering. And St. John Paul says that suffering has a meaning, one meaning, not multiple meanings. And the Course uses the example of Dr. Viktor Frankl, a Jewish psychiatrist who spent part of 1944 and 1945 in Auschwitz and Dachau, while his wife was in Bergen-Belsen, where she would be executed. Amidst this horror, Dr. Frankl said to himself, if there is meaning in life at all, then there must be meaning in suffering. And we use this example from his later life where he talks about a patient who came in to see him, an elderly general practitioner whose wife had just died and had caused him great suffering. And Dr. Frankl said to his patient, "Sir, what would have happened if you had died first and she had to stay behind?" And the general practitioner said, "Oh, it would have been awful for her. She would have suffered greatly without me around." And Dr. Frankl says, "You see, doctor, such a suffering has been spared her, and it was you who have spared her such suffering, but at the price that you have to survive and mourn her." And this elderly general practitioner didn't say anything, but he looked Dr. Frankl in the eye, shook him in the hand, stood upright, and walked out. Because he discovered that suffering ceases to be suffering at the moment it finds a meaning, such as the meaning of a sacrifice. And in sacrifice, St. John Paul says, we have the meaning of suffering, because that sacrifice leads to salvation or redemption. That is the meaning of suffering. And we explore that in the Course. And then we follow what John Paul says in what to do with our suffering. He says, first, we are supposed to do good by our suffering, and then we will be able to do good to those who suffer. So we talk about ways to do good by our suffering. 7 hints, including a profound one of embracing suffering, at least embracing unavoidable suffering. For God does not intend that we should seek out suffering to embrace. But as Christ embraced his unavoidable suffering, we are to imitate Christ. And I believe John Paul shows us what is in this black box. It's embracing, amidst our suffering, the suffering of Christ on the cross. Because I firmly believe that only Jesus Christ, only God himself, can convert suffering into joy. And when we physicians have learned how to do good by our suffering, then we can do good to those who suffer. And John Paul gives us 3 concrete steps to do it. The first step to do good to those who suffer is stop. Be there. Woody Allen said that 80% of life is just showing up. I don't know if the percentage is right, but if we don't show up, we can't do the next 2 steps. The second step, John Paul says, is to show compassion. And compassion literally means to suffer with. And even if we don't feel compassion, we can act compassionate. And then the feelings will come later. And one way it comes is by treating the patient as a person, not as an object, not as a consumer, not as a cost center, but as a person. And they will note that. And then the third step, John Paul says, is to give concrete help. If we don't know what that concrete help is, ask them. Sometimes that concrete help is just being present with them, someone to share time and space with them. Sometimes it's just a touch on the shoulder, on the arm, on the knee. But it does involve being vulnerable, which is something difficult for physicians, and a virtue we all seem to like better in others than ourselves. But patients will know if we're being real, because if we're faking it, they will sense it and their suffering will not be reduced. It might even be increased. So in summary, how can good prevail in the midst of patients and doctors who are both suffering? Well, by first addressing physician burnout. For to paraphrase Dr. Francis Peabody, the secret to the care of the physician is to care for the physician, even a burned out physician like this. And then secondly, patients, doctors, will want to have their ignorance overcome through courses such as this, which are available free by contacting the Catholic Medical Association office. And then the CMA will have succeeded in helping its physicians to become inspired physicians imitating Jesus Christ.